Healthcare is one of the most basic and valuable human rights that ensures human dignity. However, when we have a system that's poorly integrated with competing interests and poor access, we fail our citizens. Thank you, esteemed judges. My name is Sasha, and today I'm joined by my colleagues, Karina, Elena, and Karen. Together, we're excited to leverage the future of technology trends in healthcare to ensure the integration of the private and public healthcare system in Malta and to really make Malta a forefront in healthcare. What we'll be doing today is three things. First, we're going to go through a diagnosis and evaluate the healthcare system in Malta. We'll then treat through the Healthier Together strategy comprised of three main parts. And finally, we'll go through the recovery, which includes the implementation, finances, and finally the key takeaways. So let's first dive in and take a look at the current system of healthcare in Malta. While Malta healthcare is primarily a public system, there's an equally competing private healthcare system. And we can see this through healthcare expenditure, where 30% is spent on out-of-pocket private care. What this means is we have competing interests between public and private. If we then dive into some of the public health issues, we see that 66% of the population is currently overweight, and this leads to a lot of healthcare problems later on, with 82% of Maltese dying from non-communicable diseases, and about 50% of those diseases causing death being cardiovascular. There's also a major drug problem, which is the number 10 highest accounts of drug deaths in the EU currently. Now let's dive in and do a specific diagnosis of the patient journey in Malta. As we can see, as a patient, you go from pre-patient to then perceiving an illness, and once you've perceived this illness, you have the opportunity to self-refer yourself to either the public or the private system, and from there you get treated and go into post-patient. This current system raises a variety of different problems that we've analyzed. First, in the pre-patient and perceived illness area, we see that there's a lack of general public health awareness, leading to problems like obesity and drug-related issues. Once a perceived illness has been treated, there are issues of uncertainty regarding your different treatment options and a lack of general awareness, and as well, too many self-referrals. This is indicated by 70% of referrals being self-referred in Malta versus only 30% in the rest of the EU. Once someone actually decides to get treatment, there are several issues with the competing interests of the public and private system, where because the private system can prove more lucrative in terms of profit, we see some of the best healthcare professionals actually going into this private system, and then as a result, there being major disparities in the public system. We also see a general competition of services between public and private. And then when we finally get to the post-treatment areas, there's inconsistency in follow-up because the system is overinflated and bloated, and there simply aren't enough people for treatment. So now, this leads us to three key insights. First, competition in the public and private system is worsening the overall quality of healthcare in Malta, and this must be addressed. Second, there's inefficiency and overcapacity, and so we must increase the overall size of the pie of healthcare in Malta. And then third, public health is a key issue and becoming a crisis that we need to address to create a healthier society and country. Now let's dive into some of the exciting healthcare trends that we're seeing emerging. There's strong precedent for Malta to become a leader in healthcare, not only because of your prior history, but because you're an exemplary test pilot country in the EU for emerging healthcare trends in Europe. In terms of global health trends, we're seeing three main ones emerge that have really driven our recommendation today. First is the concept of hyper-personalization and patient empowerment. So patients actually know what's happening to them, and they can actually aid in the process of preventative care. Second is AI and machine learning integration to really power new and exciting integrated systems in health. And third is the idea of the unification of the overall healthcare system and getting rid of this disintegration of different players.
Great. So based on these understandings of the healthcare industry and the environment in Malta, we're excited to present to you the Healthier Together strategy. So this is going to tackle the three key issues that my colleague Sasha has mentioned with three main prongs. The first issue is understanding the unhealthy competition between public and private healthcare providers. To solve this problem, our strategy is to unite. So this means regulating the private system so that public and private interests are united. The second problem that we're going to be solving today is looking at the inefficiency and abuse of the public healthcare system. To solve this problem, we're going to be looking at our second part of the recommendation, strengthen. And what this means is we're going to be introducing MaltaCare, the AI-based system that we'll be putting into the public healthcare system in Malta. And this will result in cost savings of $200 million by year 3 in perpetuity. And the last problem that we're going to be tackling today is looking at the poor public health education. And to solve this, we're looking at our third part of the recommendation called GROW. And this is going to be looking at the long-term education of public health and of doctors. And this education program should be looking at $600 million in cost savings of the healthcare system by year 5. Now, my colleague Sasha has taken you through the previous customer journey when we're looking at patients in Malta. And with our recommendation, there are going to be two key differences. In the pre-admission section, we're going to be looking at an educational campaign that will ensure preventative care of Maltese citizens. The second part is looking at the integrated online system. What this means is that patients are now going to be able to register and have a diagnosis before they even come in to see the doctor. Then this is going to streamline appointments and increase efficiency of health rooms and of the doctors in this system. And lastly, this is also going to improve the follow-up experience of the patients. So now let's first dive into that first part of the strategy, looking at the public-private competition. Now, here we see a layout of some of the issues associated with having two parallel systems in the public and private healthcare industries. The three main issues is firstly the talent issue. When there is an identical private system for healthcare, the talented doctors will actually move from the public system into the private system for better salaries. And this is going to exacerbate the issue of a shortage of doctors in the public system. The second is the service issue. Because the private system will inevitably become stronger, there will be a higher disparity of service that is available to high income versus low income citizens in Malta. And thirdly, it's the health issue. The private sector will always be profit-driven, which means they will only service patients who have common or profitable treatment needs. And this means that people with other needs that are more special or unique will not be properly treated. So to solve this problem, we are recommending a full regulation of the private healthcare system. So what this means is that in the current system where the public system does not own any single entity of the healthcare system, we will actually be transforming that so that the public system will have sole access to general practitioners and hospitals, which are core healthcare essentials to the Maltese population. Now, clearly, this strong change in regulation is going to need a lot of buy-in from the different parties. So in terms of the implementation plan of this part of the recommendation, we have a 3-year timeline. The first part is really doing a very comprehensive policy discussion to make sure that we hear every single stakeholder that has interest in this problem. The second is to look at phase 1 regulation. So this part is really looking at hospitals and how we're going to be able to acquire all the privately held hospitals and transforming the management to cater to the public interest of Maltese citizens. And the second, by year 3, we want to have all GPs to be publicly owned as well.
So as Malta is positioned in a unique opportunity to be able to pioneer and create new healthcare systems, this is why we believe Malta is the perfect place to introduce MaltaCare, a unique AI integrated system that currently many countries don't have. What we're suggesting is 3 steps, and I'll first walk you through the patient experience, and then I'll take you through the user experience from the healthcare practitioner side. Within the patient experience, we start off with patient information. What this looks like is an integrated system that documents all of the different information that we have of the patient themselves. From here, the patient can see their history of treatments, and also they'll have information on their primary care facilitators. Then they'll also be able to click a diagnosis of if they think that they have potentially an illness and what they can do next to treat this specific illness. From here, they go to the referral system. So rather than incorrectly self-referring themselves, they'll be able to complete a questionnaire, and this questionnaire will provide several suggestions of proposed facilities. For example, although they might be at a facility that's too close to them, this facility could be overbooked, and instead it'll suggest another facility that might be under capacity currently. So this will propose a more overall smoother healthcare system in general. Furthermore, their next step is to then be able to tell them what types of tests they need to take. Rather than just rushing into an actual facility, they'll be able to understand what type of information they need to prepare, so it alleviates the burdens for these healthcare practitioners. So once they understand this, they have the opportunity to book their appointment directly on the system, and this information translates immediately towards the healthcare practitioners. So let's take a look at what the healthcare practitioners side of the platform sees. As we can see, it also has 3 unique steps. First, they'll be able to gather information of all their upcoming patient info. They'll be able to see who they're diagnosing and exactly have the information of their schedule. This will be broken down to day, month, and also a projected future schedule, so they feel like they're not overburdened as they currently are. Furthermore, they'll also be able to communicate with their team and be able to work together on solutions, whereas instead perhaps before they were feeling very burdened with their current situation as we see today. So now we'll also take a look at what we want to do to propose to attract and adapt these different stakeholders onto this platform.
So we understand that the future of healthcare is in integrating technology for better solutions for healthcare practitioners, not necessarily replacing doctors with robots. And the MaltaCare platform really enables doctors, patients, nurses, and healthcare providers to put users at the center of their experiences. So how do we plan to really get the public, the private sector, and the patients on board? We plan to work with a PR company to launch a video that really explains the artificial intelligence integrated process that will be taking place. BCG has just launched a very similar video where they explain how they've integrated artificial intelligence into the airline system. It will take people through the whole customer journey, understanding how artificial intelligence improves booking systems, how it increases the efficiency of nurses' shifts, how it improves the customer journey and follow-ups, and in understanding their diagnoses. So we will communicate with the public and with patients through this campaign. And as well, we will be creating tutorials for the private sector, the public sector, as well as for patients on how to properly use this portal and toolkit in order to ensure proper implementation. In order to really dive into this, we're going to show what all the steps are of the benefits of the AI solution to really get patients on board, but then also really explain to patients how to use it. And as well, if we have concern about patients having access to computers to really use the technology, we'll have computers available for use at actual healthcare spaces. So how will the funding for this type of platform look? This will be a unique PPP whereby the public sector will work with a private artificial intelligence company to construct this toolkit for implementation. We're looking at 50% government funding, 25% private with the artificial intelligence sector for this PPP, as well as a 25% contribution for the EU. We've seen historically since 5200 that Malta has been the center of healthcare innovation. It's perfect as a pilot because of its size and location. So we recommend that the EU contribute to this exploration of innovation in order to use this as a pilot to roll out artificial intelligence in healthcare beyond the Maltese. The short-term timeline of this will be development of the platform in 2 years, and then we will pursue education and rollout in order to really get healthcare practitioners and patients on board. This leads into the next segment. We've seen key issues in terms of obesity in the population, as well as not enough doctors and nurses. We're going to address this through 2 key campaigns. We're going to recruit doctors both within Malta and bring doctors from abroad, one through research grants to bring more people to Malta and really create a hub of innovation around medical care there. 2, to subsidize medical school for highly talented individuals coming from abroad to Malta, as we know about the high quality of their education. And 3, as we've seen implemented in other countries like Canada and the United States, a nurse day to acknowledge and recognize nurses, making the profession more highly respected and making more people pursue it. Then looking at improving health, we're looking at nutritional programs, school programs, and corporate programs, upon which I will elaborate further. So we've seen that 66% of the population is obese, and 40% is in children. So we're going to target children and corporations separately. We're looking at first nutritional labels like we've seen in countries like Singapore, whereby food products are assigned health rankings. So 1, it's at the top of consumers' minds whether or not this product is healthy, and 2, it makes it easy for them to understand. Second, in terms of school programming, we're looking at integrating daily physical activity into the education system to really encourage healthy activity from a young age. And then corporate subsidiaries so that governments can encourage corporations to engage with their employees in activities that are good for health and wellness. By year 3, reducing the burden on the health system can yield up to $660 million in savings as a result of preventative health measures. In terms of recruiting doctors, we've touched on the mechanisms that we plan to put in place in order to address the gaps in the healthcare system, and we would be happy to elaborate upon them further in the question and answer period. Right now, we're going to take a look at the projected cash flows associated with this implementation.
Great, so let's take a look at the summary in terms of financial metrics for this plan. Now, in terms of the cost savings, the main areas that we'll see these are in terms of the AI system, so streamlining that entire patient and doctor process. The second part is from the preventative healthcare. When we educate a population to eat healthier and to exercise more, we can realize savings in year 5, and in present value terms of $660 million, along with the $200 million of savings from the AI system. That is cost savings totaling to $860 million by year 5. Now, in terms of the major costs, the AI system will cost approximately $50 million, along with education budget, the corporate grants, and then we're also allocating budget to give research grants to encourage that AI system in healthcare, as well as scholarships for medical students to solve the problem of the lack of doctors in Malta. And lastly, tax cuts for the private healthcare owners so that they are more bought into the regulated healthcare system. Now, in terms of the funding, as we had mentioned before, 50% of this cost will be from the Maltese government spending, 25% from EU support, and 25% from the private partners in the PPP.
So let's take a quick look at the overall implementation strategy. As we mentioned before, we need to start off with transitioning the public and private conflict that we see today. So introducing those regulations so that we have a better and more balanced system. Second, we also need to introduce Malta Care. So as Lainey walked you through the timeline for that, that includes funding, development, the educational program on how to use this new platform, and also introducing the pilot. Next, we also have the public health campaign, and also we have more the long-term approach of introducing new, attracting funding in order to increase our healthcare practitioners, so we have a supply of doctors that we are missing today. We also have an overall risk and mitigation strategy, but we'll be happy to walk you through that in Q&A. And what I'd like to do now is highlight some of the 3 key takeaways of our presentation. So overall, we are happy to introduce our united healthcare system of Healthier Together. And this new system is designated to increase efficiency that we currently aren't seeing the current Maltese system have. Secondly, because we'll be able to position Malta as a leader in this region, and we'll be introducing a new AI healthcare system, this will introduce overall cost savings of approximately $200 million over the next several years. And finally, we'll also have a more sustained and healthier, stronger, and a long-term vision by promoting a healthier public, including better, healthier living, and more important labeling that is currently missing so that the public themselves knows how to prevent the issues that we see today. That being said, this will lead to savings of approximately $660 million. So thank you very much for your time, and we're now excited to open up the floor to any questions.
Thank you very much, and we may now proceed to the Q&A session.
Thank you very much. Happy to start. very good presentation. What strikes me here is that you essentially nationalize a large part of the healthcare system again without saying it. And I would like to understand a bit more how this will work. How will it be funded? And when I look at the problems in Malta, a large part of it is actually the inefficiency in the public sector. And I feel we lost it a little bit in the way we talked about it, because we say actually the public sector is the solution to this. So I'd love to hear a bit how that filtered or factored into your recommendation.
Absolutely. So to begin, in terms of the funding that goes towards the public health care, at this time we're going to maintain the two types of funding that the Maltese are paying in based on their tiers of age and education. We see a contribution between 6 and 50 for one type, and then between 18 and 62 for the phase 2 type, and that's the current contribution to public health care. However, we also anticipate the need of a new investment to integrate the private system through the artificial intelligence platform. The issues that we've seen in the current public model largely revolve around inefficiencies, and they're being exacerbated by the fact that 30% of out-of-pocket spend is going towards private, which is enabling the public sector to continually worsen. Thus, by using the public funding, sorry, would you like to clarify?
Well, I wonder whether that is true, or whether this is actually services that the public sector currently doesn't provide, because waiting times are too long, it's too inefficient, and that's why people actually go to the private sector. We at the moment say we shut off the private sector, and therefore people will go back into public.
Right, that's why the implementation timeline, Karen can elaborate on it for you, involves an integration whereby we start by using the private sector, really leveraging their advantages in order to still cater to the population with the services that they need. And then over time, we will ultimately be able to acquire those private services and integrate them into the public system and unify all of it under an umbrella of artificial intelligence, so that we're able to really increase efficiency, reduce waiting times, and have a unified system that also is data-driven to improve more efficiencies further.
So just a quick note, one thing we want to highlight is this transition will take time, and what we're suggesting is not to immediately have a public-private partnership, because we understand that that is a conflict today. What we do want to emphasize is with this transition, public will be able to focus on more of the general issues, and over time, private can then specialize in these niche health markets where they'll be able to generate higher profits for their shareholders. That is what they're overall looking for. So yes, they are very profitable today in where they are, but they can be more so in the future, which is why we want to emphasize this transition.
Can you go back to one slide where you have the three circles crossing each other? GPs and so on, because you're too fast for me. Yes. Okay. No, public, private, just three circles. Maybe the one after that.
Maybe if we can try to answer your question while she's looking for that slide.
No, I need to look at that to refer to that, if I may. It's very near to this one, I think, but
The pie chart.
no, it's one circle there.
Is it the patient life cycle?
You need a paper underneath.
You don't have a circle there at all.
Shooting in the dark. Circle.
Okay, maybe this one will do. Maybe this one will do. If you look at the left-hand side of the slide, there's the public, there's the private. The middle part is it says GPs,
Hospitals and
specialists. And then you have on the right-hand side, dental. Is it dental?
Yes.
Dental, highly specialized. So it seems that the simpler diseases will be treated as public, right?
Absolutely.
And then it goes on to the very complicated on the right-hand side, the private. Now, that's fine. But there's one statement you have made, and that is you unite private and public, but you have to regulate the private. how do you regulate private sector? We've never been able to regulate any private sector
Right, so our main
because it's a market. It's a market forces. How do you regulate that?
Absolutely. So the main
By
problem,
law or by what?
Yeah, so our recommendation really goes into a longer term strategy with a 3-year implementation timeline. And so that first part of we take an entire year to talk with every single stakeholder that would be affected by this problem to understand what their interests are, and by the end of the year to have a strategic overview of how we would approach this
So it's
policy.
by public education, basically.
This one would be more of a roundtable working session with privately owned healthcare systems currently in place, as well as regular citizens, other doctors, general practitioners, and specialists. And from this, what we're looking towards in terms of the overall goal, what we'd like to see is that we don't want the private sector to overtake all of the healthcare services. We see that in Malta, they have a disproportionately high percentage of patients going into the private healthcare system because the public healthcare system has been a little bit more inefficient and had less funding for these services. So with the 3 problems that we had identified in terms of the talent issue, the service issue, and the health issue, we see this as a great problem posed to the general public of the Maltese
No,
population.
what I mean regulate the cost
What we're saying is that we want to be
of the
regulating
private sector.
the services provided by the private sector by being able to acquire their current systems. And then in terms of being able to appease this group, we would be giving them tax cuts on their businesses for the first few years.
Yes, and once we've also established the needs of the stakeholders, like you were mentioning in terms of legislation, in order to get the private sector on board, we will first try to phase in an approach with tax benefits, whereby if they're going to be a part of this system, we will offer them a break on the income taxes coming from their practice to integrate our system and work with us on this. And that would hopefully ensure that in a few years we would actually just be able to make an acquisition of these systems so that they could be internally regulated. However, if the taxes in and of themselves were inefficient, then yes, we would have to look to firmer legislation like law implementation.
Hi, thank you again for the presentation. Just a quick question on the topics of self-referral and also over-prescription. So we understand that with the AI system, you can do the self-referral. So I was just wondering how you battle this with 70% self-referral. That seems to be a bit of an issue. And with the over-prescription, how are you dealing with that?
So part of the problem that we're seeing with the current system, and part of why the public system is so overbloated and sees overcapacity, is because of this large amount of self-referral. So what we're going to use with the new toolkit is people first go through a questionnaire where they go through the symptoms that they're having, and this will then refer them to a general practitioner in their area that's really optimized based on need. Individual patients will then need to go through a general practitioner and then get referred to a specialist. So this is actually going to help improve the efficiency and prevent people from using services and going to them when they don't need to. And then in terms of the overprescription of drugs, we also will have this machine learning and AI-powered system because it's going to help provide checks and balances to doctors. So what this means is that before a doctor actually prescribes something or sends someone to a specialist, it says, have you actually done all of the necessary checks to ensure that the patient needs this medication or to ensure that they need to go to this kind of specialist? So this is really going to make sure it's top of mind for the doctor before they're overprescribing and using more funds than necessary for the patient.
So quickly on this self-referral. So the idea is that you go through the system and then you go see the GP. So does that mean that this is called pre-admission? So I wonder, since the majority of the people prefer to do self-referrals, does that shed some light to say the ability of the healthcare system right now to perform that initial pre-administration? Is it because it's not very good that they want to do the self-admissions? Yeah.
So the idea is with our new toolkit and system with MultiCare, we're really improving the accessibility of information to individuals because right now there's a lack of understanding of what the formal system should be and what the best process is to get the best healthcare possible. So by having greater transparency of information and by going through a general practitioner first, this will actually allow someone to understand the healthcare that they need.
So I really like the idea of an AI-based system, MultiCare. The problem is that a lot of the patients are old, right? And that demographic normally doesn't respond well to a mobile phone app or something on their iPad because they don't even know what AI stands for. So how will you overcome that, and especially in the timeline that you have set out?
That's an excellent question regarding the actual user adoption rate for the older demographic. So first of all, in terms of the patient-facing side of this technology, there's no AI branding at all. It's really just let's go online, book an appointment. As my colleague Lainey had said, one of the ways that we're going to implement this to drive user adoption is to actually have those appointment booking systems in your doctor's office or in the hospital itself. So you don't even have to be at home and try to figure it out on yourself. So the next time you're seeing your doctor, when you're checking out and seeing the secretary, she will or he will go through the system with you to drive that user adoption and to help you learn about this system.
One final point I'd like to ask is, you have thought about this, but you have not included in your presentation a sort of survey of opinion of actual patients. Will you do that? Because you talk about all these and it seems to you it's very good, but to the patient, potential patient, so would you include a survey of citizens about your method of dealing with this?
Exactly. So that would be very idealistic for us to propose to launch this program for all 400,000 citizens of Malta. So what we're actually proposing is a pilot program. We're going to be doing continuous testing to introduce new features and to specifically perhaps look at one city as opposed to introducing it to the entire country. This will ensure that we're going to be able to get the feedback we need to develop this program over the next 3 to 5 years, because this isn't going to be an immediate adoption, since we see this as a more of a long-term strategy to transition the country from a public-private partnership that we see today.
Before you do the pilot program, you have to do a survey because it's so complicated, you know. Most people will not be able to understand.
For
at
sure,
least 100%
we're
of what
definitely
you're
going to
talking
be proposing focus groups and using the lean startup model. So that's something that we want to introduce before we even begin the actual pilot launch, perhaps.
One more quick one for you. What do you think is the biggest challenge?
I think after government cooperation, which is a huge challenge, the first major challenge will be that this is the first country that will be implementing an AI solution at the forefront of their healthcare system. All of the consulting firms are talking about it. All of the health tech analysis is discussing it. But no one has been as uniquely positioned as Malta to actually take this step because of their history as being at the forefront of innovation, because of their contained size and ability to pilot. So being the first to actually do a disruptive innovation is obviously tremendously difficult. And like Professor Leung mentioned, has obstacles in understanding users. However, the benefits that both Malta and other countries will be able to see from shared best practices will be tremendous.
Thank you very much. Well done. Thank you.
Thank you very much, McGill University. You may now proceed back to your seats. Thank you very much.
Thank you. Thank you very much.
Thank you so much.
Thank you.
Thank you so much. Thank you.